The U.S. healthcare system is the tapeworm of our economy. It's draining the bank accounts of our business owners, their employees, and families, and it's time we do something about it. My name is Travis Bockenstedt. I'm the President and Chief Experience Officer of Pinnacle Advanced Primary Care, and for the past 7 years, I've dedicated myself to healthcare reform. At Pinnacle, we are disrupting the U.S. healthcare system through our membership-based healthcare model called Direct Primary Care, also known as DPC. DPC is a free market healthcare system that is membership-based and is not attached to big healthcare or big insurance companies. What we have seen through U.S. healthcare policy over the past decade is constantly putting Band-Aids on the ACA. While there are great things that the ACA does, such as protecting people who have pre-existing conditions, there are many areas of improvement that could be made. What we are trying to do is to bring free market healthcare into the mix of our healthcare economy because we believe that is the right thing to do to lower cost and provide better healthcare to U.S. citizens. Right here in Colorado, we actually have the opportunity to expand direct primary care to Medicaid recipients. Currently, the state of Colorado is one of 2 states in the country where Medicaid recipients cannot electively go to a direct primary care practice. We believe that these consumers should have choice in where to receive their primary care, just like everybody else. What we will be working on in 2026 is to pass legislation to allow Medicaid recipients in our state to direct contract with the DPC of their choice. We are not asking for Medicaid dollars to supplement their membership. All we are asking for is that these citizens have the opportunity and freedom to spend their own monies on primary care that meets them and their families' needs, and we would work with the Medicaid system to help them with coverage needs for major medical needs, specialists, and different things like that. But we really do believe that if we can reattach our Medicaid system to high-quality primary care, we can not only have better health outcomes, but reduce the burden on taxpayers in our state. There will absolutely be no cost to the taxpayer if we do expand access for Medicaid recipients to contract directly with the DPC. The other opportunity we have with direct primary care is to bring free market principles to employers in our state and right here in Southern Colorado. And what we are looking for is legislation that promotes and encourages the free market in healthcare because we believe that is the way to lower cost. We know that healthcare is often the second largest line item for most companies, but they don't have the resources to pivot or the knowledge to implement new healthcare systems for their company. What I am asking voters to do is to consider alternative healthcare options that are viable and working to provide better healthcare while lowering costs for everyone. So as we go into this next legislative session, what I'm imploring folks to do is to make sure that we are considering free market solutions every time a healthcare conversation comes to the table. I want you to ask a basic question when you see your legislators. I want you to ask them if they are familiar with free market healthcare principles like direct primary care. And if they are not, give us an opportunity to help educate them so they can make better policy decisions when it comes to healthcare.